stroke is an emergency that demands immediate medical attention. If you think you're having a stroke, you need to go directly to the nearest hospital emergency department. It's the most important thing you can do. An ambulance is usually the fastest way to get there. If you or someone you're with is having a stroke, call 911. Tell the 911 operator that you think a stroke is happening and explain the symptoms. When the ambulance arrives, tell the paramedics the same thing, that you suspect a stroke and the reasons why. On the way to the hospital, the ambulance crew may start an intravenous line and give you oxygen if you're showing signs of stroke. They will also call ahead to tell the emergency department that a stroke patient is on the way. Before you arrive, emergency department staff will prepare your bed and make sure that important medical equipment is ready and waiting for you. Knowing what to do when a stroke happens and how the emergency department works will help you get the fastest and best care. Once inside the treatment area, you'll be taken to an exam room and moved from your stretcher to a bed. This is where several people will attend to you, either one after the other or all at the same time. The emergency department at New York Presbyterian Hospital is one of New York's busiest, treating more than 100,000 patients every year. Nevertheless, if you arrive by ambulance showing signs of stroke, you'll receive the highest priority treatment. Triage is the process of deciding which medical conditions need treatment first, so a triage nurse will usually be the first person to see you. Tell the triage nurse the same thing you told the 911 operator and the ambulance crew.
Yes, sir. My name's Erica. I'm one of the nurses here.
I think he's had a stroke.
Okay.
He's not able to move his left hand.
Okay. When did this start, sir?
About a half hour ago.
If you got to the emergency department quickly, you may be eligible to receive TPA as a treatment.
Okay. If you give me just a second, I'm going to go talk to the doctor real quick, and we're going to go have the stroke team.
At the Green Bomb, if you have a call line 1, it would be at the Green Bomb.
A registration clerk will also meet you in your room.
Hi, Mr. Soto. My name is Tina Martinez. I'm a patient representative here. I'm just going to ask you some questions. Is that okay?
That's fine.
Great.
The clerk will collect information such as your home address and phone number, your next of kin, and insurance provider. You can save time by showing the clerk your hospital card with your medical record number on it. This number is assigned only to you, and it's used to track and identify your blood specimens, lab tests, x-rays, and CAT scan.
Thank you so much, Mr. Soto, and the nurse should be in with you shortly, okay?
Thank you.
Thank you.
Soon, your personal nurse will arrive to talk with you.
Hi, Mr. Soto. I'm Sherry. I'm going to be your nurse today. The doctor's asked that we start some oxygen and draw some labs and put a little IV in, okay?
He or she will start your oxygen, insert an intravenous line, and draw blood for tests.
Feel okay?
That's fine.
Okay.
The nurse will discuss your case with the emergency doctor and help the doctor with your tests and treatments. Show your Swift Study bracelet to your nurse so she'll know to call the hotline and alert the study team. Next, the emergency doctor will see you. He or she will begin the medical evaluation by asking you to describe what happened and how you feel.
Why don't you tell me what happened to you all over again?
I was eating breakfast, reading the newspaper. I went to get a cup of coffee. I dropped my coffee cup. I tried several times to pick it up. I couldn't pick it up.
And you couldn't do it. Let me ask you, were you standing at the time?
Yes.
And did you feel unsteady at all?
I was never unsteady.
Were you able to walk back to a chair?
Yes.
And you didn't stumble or fall?
No.
Okay. Did you notice any change in your vision?
My vision was a little blurry, but it's fine now.
Did you notice any change in your speech?
No, not really. This is my left arm. I can't move it.
Okay. Let me just check out your weakness, okay?
The doctor will then examine your body and make a preliminary diagnosis, deciding which tests or medications you may need and what to do next.
You're going to need a CAT scan next, and the neurologist is on his way down. Let me get those things moving, and then I'll be back with you, okay?
Okay.
Okay.
If the doctor suspects you're having a stroke, he or she will call for a neurological consultation and a CAT scan. The neurologist will talk to you and examine you, usually within 15 minutes of your arrival in the emergency department. Shortly after your neurological consultation, you'll be taken to the CAT scan room. A CAT scan is a special type of X-ray test that gives a detailed and complete view of the brain. It will help the emergency doctor and the neurologist find out the type of stroke you're having and the best treatment for it. The CAT scan procedure takes less than 4 minutes, but it will take about 20 minutes to fully process and review the results. When the CAT scan is done, you'll be brought back to the treatment area. There you may undergo other tests such as a chest X-ray or electrocardiogram.
Great, thanks.
As soon as your test results arrive from the lab, your emergency doctor, neurologist, and radiologist will review and evaluate them. They'll consider many factors to determine if TPA or another treatment is best for you. Deciding whether to use TPA is a complicated process and it requires a team effort. If you are not a good candidate for TPA, there are many other treatment options available. Either way, the sooner you get to the emergency department, the better your chances for a positive outcome.
I think that we're kind of ready to go back and tell him that he needs TPA.
After reviewing all the tests, your doctors will explain their recommendations and give you time for questions before they take any further action.
Mr. Soto, we reviewed the blood tests and the CAT scan.
You were right. You are having a stroke. But you did the right thing. You called 911 and you got in here immediately. So we're going to be able to give you that medicine we talked about, TPA. We're going to give it right now, okay?
Okay.
You now know the basics of emergency stroke treatment. If a stroke occurs at any time of the day or night, wherever you happen to be, you'll know what to expect and how to get the best care.
Hi, so how are you doing?
I'm doing a lot better.
Good. Well, let's see if you can move that hand. Well, that's substantially better. So it looks like you're tolerating the medicine well. The best thing you did was come in early and fast to the emergency room so we could give you TPA, and it looks like it's going to help you. Now I want to get you upstairs to the intensive care unit. We're just about ready to send you upstairs. All right?
Thank you.
All right.
Remember to call 911 as soon as you notice stroke symptoms. Get to the hospital quickly and tell everyone you speak with that you suspect a stroke. Your emergency healthcare team will take it from there.